We continue our course on veterinary dental radiographic interpretation with a segment on recognizing and managing cysts and oral masses. This is an image of the right mandible of a cat. No gross changes are present here. No changes that we would suspect disease. However, radiographically, when we look at this same area, we can see that there's a large defect adjacent to the apical portion of the distal root, where 25% of the root has been destroyed, along with an expansile lesion and lucency in the bone that's very well defined. And generally, when we see that type of radiographic change, we can associate that with a cyst. It's not definitive until it's sent and documented via histopath. However, this is fairly predictable, and we can pretty much assume that that is a cyst until proven otherwise. The thing that we most commonly see are dentigerous cysts that are associated with unerupted teeth. In this case, this would be a cyst derived from the periodontal ligament cells that are still remnants within that space when the periodontal ligament was formed. And those cells are cells of Hertwig's epithelial root sheath from an academic standpoint. However, clinically, we can assume that these are just from possibly trauma or spontaneous activity of those cells to produce this epithelial cyst. Extraction and cyst removal is the way to approach these, and in order to gain access to that, we need to create a flap that exposes the bone, enlarging the area around this distal root in order to be able to visualize and remove the cyst in its entirety. And as these things progress, what they'll do is they'll expand into the periphery of where the bone is as you see it radiographically. So in this cyst, the lining would be, of course, three-dimensionally, but looking at it from a two-dimensional standpoint, it would line that entire peripheral extent of the bone, and then the tooth root here, 360 degrees in a three-dimensional orientation. So when we remove those, we need to get in with, generally, in this particular case, we'd use a periodontal curette or a periosteal elevator and just scrape the lining of that bone and remove any remnants of tissue that's present. Now, in this case, we would have to be concerned that this cyst has gotten into the mandibular canal, and in this particular case, it had not, and had kind of expanded around it. So, fortunately, not a tremendously difficult procedure, but we could certainly get entrance into that canal, and pain as pressures exerted on that inferior alveolar nerve, and signs accordingly. However, I've never really seen that in that presentation before, but it's certainly possible. This is an instance where a biopsy was taken, where a swelling was present on the left rostral mandible on this cat, and the suture you see here is from the initial biopsy, and the biopsy came back as normal inflammatory tissue and was not diagnostic. So